Hi everyone, Dr. Timothy Gallagher here.
And I'm Dr. Michael Perkins.
And we're from Maragal Medical. This week we're going to be talking to Dr. Perkins. As you remember from 2 weeks ago, Dr. Perkins is our new physical therapist here at Maragal Medical, working with Colleen. And Dr. Perkins has an area of specialty. He works with patients that are having problems with vertigo and issues with balance. There's going to be a lot of great information today, so you're not going to want to miss this one, so stay tuned. Okay, Dr. Perkins, we introduced you last week. You're settling in the office, doing a really great job with the patients, so excellent work there. I was really excited too because you have this area of specialty, something that we've wanted to bring into the clinic for a few years now, and I thought this would be a great opportunity to speak to the public about what that specialty is and the types of treatments that we can offer now.
Absolutely. So I've been working with vestibular deficit patients for a while now, and most commonly that is patients who suffer from vertigo. This is a balance issue that is triggered by a malfunction of the inner ear balance mechanism, which can be very disorienting and lead to a sense of disequilibrium. Most commonly, we see patients with BPPV, which is benign paroxysmal positional vertigo. Their symptoms are frequently feeling disequilibrium, nausea, and the sensation that the room is spinning, oftentimes associated with positional changes because it's positional vertigo. These symptoms can be extremely debilitating, can lead to a patient's sensation that they may be careening off to one side. They can be extremely intense, and typically they're short duration symptoms, but they can last until the problem is solved. Thankfully for us in the clinic, we can identify it quickly and oftentimes treat it and resolve the symptoms within 1 or 2 sessions. The associated symptomatic diagnostics we look at are your eye movements. Vestibular problems have deficits with your vestibular ocular reflex. This is the sensation that allows your eye movements to match up with your head movements so that you don't get that shaky camera visual input sensation. And so if you're having any of these issues where you're laying down getting dizzy, standing up feeling the room is spinning, careening off to one side or favoring one side for balance, or having any visual disturbances when you're turning your head, these are all signs of vertigo, and thankfully they're extremely treatable.
Yeah, and typically what we would see too, we would refer out the Epley maneuver is a common maneuver that you would perform on these patients, right?
Absolutely, yep. So we would do a Dix-Hall-Pike maneuver to diagnose after doing reflex scan, and then move into an Epley maneuver, which is a treatment maneuver on a table.
So in that simple maneuver too, oftentimes relieves the symptoms for the patient right away. And then, thinking in the future too, and giving you more exposure to some of the newer technology that we have in the practice, once you get the patient stable with that, we can further enhance their balance by utilizing the Hanova robotics technology, right?
Absolutely. So the treatment is typically to use maneuvers to resolve the issue, but you may still have some underlying symptoms, especially acutely. We can do things with your vestibular ocular reflex to reduce the symptoms that you would feel if we were unable to treat it solely through maneuvers. And then, of course, we could put you onto the Hanova balance machine to shore up your balance going forward with your reoriented sense of equilibrium.
Yeah, so if you're suffering from this problem, or if you have a friend or family member, you're definitely going to want to contact the office, Maragal Medical. Again, we combine medical care, physical therapy, and chiropractic treatment under one roof. We have an area of specialty and expertise in the field of regenerative medicine. Want to check out more information about our clinic on our website at maragalmedical.com. And of course, we've got a wealth of information on our YouTube channel. We've been collecting videos for the past 2 years now, so consider subscribing to the link listed below. Well, that's it for today. I hope you learned something. Have a great day, everyone.